So what are the criteria for empiric? And that's a medical speak for treatment without proof. And there's a lot of diseases where we have to use empiric therapy. In any common infections, if the suspicion is strong enough, we might start a patient on an antibiotic without actually getting that proof, because sometimes delay can cost you. So what are the criteria for empiric plasma therapy? And essentially that is when to suspect atypical aHUS rather than one of the other diseases that can mimic it. And these would be patients who present at a very young age, where other diseases are less common, where they appear to have an atypical course for typical aHUS, where it's a very slow onset or an insidious onset, where the disease comes back. So classic aHUS, for example, will come once and it doesn't come back, and it's usually in the setting of a diarrheal episode. So if it came back, that should make you think about atypical aHUS. If there's a family history, that means somebody else in the family has had the same or a very similar disease, suggesting that there's a genetic basis to the disease. And if there's a genetic basis to the disease, it's more likely to be atypical aHUS than one of the many other disorders that Dr. Nestor showed you. And if aHUS comes back after a kidney transplant. These are all of the situations where a physician begins to think about atypical aHUS. And these are all situations where, without getting that final proof, starting plasma therapy is quite reasonable and quite effective.